Hello and welcome everyone. I'm Tanzida. I'm here to talk about our work that is deep learning based model for COVID-19 pneumonia prediction with pulmonary CT images. Here is our objectives. Our main objectives are to create a balanced dataset for COVID-19 CT images and to develop a CNN model for predicting COVID and non-COVID from CT images. We take CT images as input and we get our desired output. Here is our motivation. RT-PCR testing takes much time to predict COVID patient. Some countries do not have enough testing kit initially, the limited number of expert radiologists to analyze CT images. So those things are actually motivated us a lot to develop such a model that predicts COVID patient from CT images accurately within a short period of time. Here's some application. It analyzes the lungs infection stage to monitor patients with COVID. It plays a vital role in the development of an effective coronavirus vaccine. This creates a telemedicine network for a particular area and it reduces the stress of our frontline clinical doctors and radiologists. Here's some related research work. In reference to an early screening model is developed to distinguish COVID-19 pneumonia from influenza A viral pneumonia and healthy cases. They use two models with local attention mechanism, location attention mechanism, and they use noisy and Bayesian function for their evaluation purpose. And the overall accuracy is 86.7%. They use limited number of pulmonary CT images, that is 618 limited CT images. And artificial intelligence is approach based on deep convolutional neural network is presented by some authors in reference 3. CNN is used with 3 predictive techniques. They use 1,000 X-ray images. In another work, a respiratory simulation model is used for prognosis, treatment, and screening of COVID-19. They use 6 breathing patterns. A GRU neural network with bidirectional and attentional mechanism is also applied. The demerits of their work is it actually works well only for the small scale application. In reference 11, author proposed a CNN model approach to predict and detect COVID-19 using deep learning techniques. They use 3 pre-trained models, that is VGG 16, VGG 19, and ResNet 50 for their comparative analysis. Here is our methodology. A simple convolutional neural network is developed in our work to distinguish COVID pneumonia from CT images. We use a large dataset of 6,368 CT images, including 3,184 COVID samples and 3,184 normal samples. After making a balanced dataset, we train our model. For training purpose, we split our dataset into training and testing. 80% is reserved for training and 20% is reserved for testing. We enforce data augmentation for ensuring to see new variation of our data at each and every epoch after we have trained our network. Then we work with our base model, that is VGG 16, and after that we work with our proposed model, that is Minivizi net, which is a sequential model. Then we train our CNN network using our modified dataset. After properly trained our model, we perform our experimental analysis and comparison. We compare those 2 models from our experimental analysis and predict the COVID pneumonia from CT images. Here is our workflow architecture, where we can see that we make our balanced dataset by using data preprocessing and augmentation procedure. Then we split and categorize our data. And after that, we train our model. And finally, we do our experimental analysis on the basis of accuracy, loss curve, accuracy curve, confusion matrix, and so on. Here is our base model for predicting COVID-19 pneumonia. We consider VGG 16 as our base model, where we consider 224 by 224 image size. And we build a new fully connected layer head of the model from this, consisting of pooling layer, fully connected layer, and softmax layer, and attach it to VGG 16 on top, and then freeze the convolutional weights of VGG 16 as it is our actual model, so that only the learned fully connected layer head is trained, and that completes our framework for fine tuning. Here is a block diagram of VGG 16. Our proposed model for predicting COVID-19 pneumonia, we consider Minivizi as our proposed model, where it has two blocks of convolutional layer. We consider 128 by 128 by 3 as input layer. The input image is distributed via the convolutional layer. We also use batch normalization, max pooling, dropout, and so on. We also use ReLU and softmax as our activation function. Here is a tabular format of Minivizi net model architecture. Here we see that Minivizi prediction framework, where we finally get two classes, that is 0 and 1. 0 represent COVID and 1 represent normal or non-COVID CT images. Here is the preprocessing. We resize all the images in 128 by 128 sizes. After that, we divide the images by 225 for normalizing images intensity values between 0 and 1 and reduce the computational time. Here is a performance evaluation on basis of epoch for both models, where we can see that Minivizi net performs better than VGG16 with 88% accuracy, which is higher than VGG16, where we consider initial learning rate 0.1 and batch size is 32. Here is a corner chest X-ray dataset via VGG16. Loss curve and accuracy curve is shown here, where we consider epoch 25, batch size 32, and initial learning rate is 0.001, and we finally get accuracy 89%. Here is our dataset via Minivizi net. We see that there is a loss curve and accuracy curve. And we do this for epoch 50 and batch size 32 under consideration. And here initial learning rate is 0.001, and we finally achieved accuracy 93%. Here is a classification report for corner chest X-ray dataset via VGG16, where precision for COVID is 98% and for normal is 83%, and final accuracy is 89% accuracy. Here is a classification report for our dataset via Minivizi net, where precision for COVID is 97% and for normal is 90%, and for the final accuracy is 93%, which is higher than VGG16. Here is a graphical confusion matrix for VGG16 and Minivizi net. It is shown that the true negative and false negative values for VGG16 are 124 and 10 respectively, whereas the true negative and false positive values for Minivizi net are 86 and 12 respectively. From this data, we can see that Minivizi net reduced the true negative rate with respect to the VGG16 model. That means Minivizi net predicts non-COVID pneumonia little bit better than VGG16 model. Here is another performance simulation on basis of initial learning rate, where we consider epoch 100 and batch size 32, and we consider standard decay also, where we can see that Minivizi net gives better accuracy, which is 93% compared to VGG16. Here is another one where we consider the basic learning rate decay, where we use step, linear, polynomial, and standard. We consider epochs is 50, and here at polynomial learning rate decay, VGG16 perform 88% accuracy, but in Minivizi net we see that in both case, step and linear, Minivizi net performs better with 93% accuracy. There is data augmentation and learning rate decay evaluation for VGG16, where we can see that VGG16 gives 89% accuracy. And for Minivizi net, we see that it gives 93% accuracy in both initial learning rate, that is 0.01, and for 0.001, where we consider for data augmentation epoch size 50, and without data augmentation we consider epoch size is equals batch size, that means 32. Here is a confidence score for both VGG16 and for Minivizi net for the same image, where we can see that the image gives less confidence score when we do actually with VGG16, but in Minivizi net we see that the confidence score for the same image is actually higher than the VGG16, that is 99% accuracy. And in VGG16 we see that the confidence score is only 87% only. Here we also consider ROC curve. We perform our analysis through receiver operating characteristics, that is ROC curve. For VGG16, the area value of the ROC curve is 0.951, which is shown in A. The area of the ROC curve of the same image through Minivizi net is 0.958, that is shown in B. Here's some sample image testing where we actually shows that the confidence score and the prediction level, that is COVID or normal. Here is our conclusion and future work. A performance comparison is explored between VGG16 and Minivizi net model for COVID-19 prediction from CT images is proposed in this research work. The Minivizi achieved 93% accuracy, while VGG16 achieves 89% accuracy. During training, the VGG16 shows overfitting, while the Minivizi showed a regressed action. In future, we actually work with large different dataset to create a regressed framework to predict COVID-19 from CT images. Here is our references. And thank you all.